Welcome back into SCV today, and as you can tell, we are on the road here at Dr. Helm's office, and we appreciate giving us an opportunity to come in and talk to you about laser vision correction.
You bet.
That's the general term. Tell us a little bit about what you're doing here in this office.
What we do is we correct nearsightedness, farsightedness, astigmatism by reshaping the cornea with the most sophisticated laser technology in the country.
Mm-hmm. But you're right here in Santa Clarita, and before you couldn't get this done here in Santa Clarita.
It's been years since there was someone doing laser vision correction here in Santa Clarita, and the technology that we have far surpasses what was available prior.
What makes your machine better?
Our machine is the latest technology. It's German engineering. It's the fastest laser and most accurate laser in the country.
So the general process of what you would do with this machine, can you kind of go through that a little bit and talk about how quickly it works for your patients?
Absolutely. Well, before we get to the machine, we do a series of measurements on your eyes, including measuring the shape of your eye, the thickness of your cornea, the degree of nearsightedness or farsightedness or what have you that you have. And after these detailed measurements are done, we load that information into the computer that drives this laser. This laser then is designed to give a treatment specifically for your eye, designed for the curvature of your eye. And that's important because it decreases the risk of side effects like halos and glare that people in previous years have suffered with other machines.
Mm-hmm. Now, something that I've always said is, oh, I'm a little afraid to have something like that done. And people will say to me, oh, but it's so quick, Tammy, it's so quick. How quick is the actual process?
It's a matter of seconds. Of course, it depends upon how much correction you need, but it's a matter of seconds. Sometimes our treatments are 5 seconds or less. It's unbelievable.
Really?
Yes.
Now, I'd be afraid, what if I moved my eye during the procedure?
If you move your eye...
Are these valid things to be afraid of? Or am I the only one that...
I've been answering these questions for years, and today I can answer it and tell you that it's never been safer in terms of that. This laser follows your eye movements 400 times per second and readjusts the treatment 400 times a second to ensure that that treatment is centered on your eye.
Mm-hmm. Talk about the advancement, because Lasik is not necessarily the same as laser correction. That is one of the procedures, first of all, right?
Correct, yes.
Explain that a little bit, first of all.
Well, Lasik is the most dominant procedure that we use in this country. That's where we actually make a flap in the middle of your cornea, or at least a part of your cornea. We lift that flap up, opening a page in a book, and we reshape your cornea, and then we put the flap back down. The other way of doing the procedure is by removing the surface tissue and using the laser to reshape the surface, and then that surface tissue grows back. It's kind of the difference between sodding your lawn versus seeding your lawn. Both lead to a beautiful result, but the sod is quicker than seed. Lasik is analogous to sod, and PRK is analogous to seed. We get great results with either technique, and the technique that's best for you depends upon the characteristics of your eye.
That makes sense, and that's why you go through the entire procedure of examining the eye to see what is going to be the best procedure for it.
That's right. Not everybody is a great candidate for Lasik, and we ensure that we do a detailed examination to make sure that you are in fact a candidate.
What is the exact process? I mean, from what you hear things, this is why I want to know the answer to this question. Laser cuts into the eye, and then the muscles then reshape the eye to help get the focus. Is that right, or am I way off base in that?
Well, we're talking about two separate things.
Okay.
In terms of focus, most of the focusing in your eye, in fact 2/3, is done by the shape of your cornea. Only 1/3 of the focusing is done by the lens inside your eye, which involves some movement of a muscle. So we get most bang for the buck by reshaping your cornea.
So that's like the Coke bottle glasses. There's someone who's got the Coke bottle glasses. So you reshape the cornea so that it basically changes the shape of the lens, I'm assuming. Is that accurate?
It changes the shape of the cornea.
The cornea.
And that reduces or eliminates the need to have a correction in front of the cornea to compensate for it.
Gotcha.
So I want to switch gears a little bit. You live here in Santa Clarita. You have a beautiful facility here in Santa Clarita. What is it about Santa Clarita that keeps you here?
Santa Clarita is a great community. I've got children, and it's a safe town, And I love the fact that I can go out in town and see my patients, and we're all friends and neighbors. And I love
And the best part is they see you because they've had this.
That's right. Now they can see me.
Yeah.
That is so funny. So tell us a little bit more about what else you do here besides just the laser vision correction.
There you go.
Well, this suite here is specifically for laser vision correction, but we also do cataract surgery. As a cornea specialist and refractive surgery specialist, I do cornea transplants as well. That pterygium surgery, we also do cosmetic blepharoplasty.
So what made you to choose this profession?
Well, multiple reasons, but nobody values vision more than other senses, really. People say they'd rather be deaf than blind. To be able to restore vision is very rewarding and fulfilling.
That's a good question. Blindness obviously occurs for various reasons. Are we advancing in our knowledge, in our technology, in our ability to correct blindness to the point where people who have not been able to see can now see again?
We are in many ways. Cornea transplantation has evolved leaps and bounds over the past decade. Cataract surgery has evolved as well. In fact, when you talk about blindness, cataract is still the leading cause of blindness worldwide, believe it or not. We've made tremendous strides in cataract surgery with lens implantation. We now have the ability to give people vision both far and near, which is something that's come about in the last 5 years.
So now, would Dave be a candidate with his? What's your vision problem? You wear glasses.
Let me just say this: I can't even see you right now. You're just a big blur. No, I'm just kidding. It's
I'm usually a big blur. There's nothing wrong with your vision. No, I'd have to evaluate you, frankly, and do some measurements and see if you're a candidate.
I think I want to say I'm in the neighborhood of like 2,100, to use the old layman's terms.
I can tell you that's a range that we deal with easily.
Okay.
But today, there's something for everybody. Really, there's no degree of refractive error that we couldn't treat with something, whether it's laser vision correction or phakic lens implants that go inside your eye. We're also called implantable contact lenses. There is something for everybody today.
And the thing that gets me is, like you said, sometimes the procedure is 5 seconds. You walk out of here, it's not like you have patches over the eyes. You're seeing.
You walk out seeing. Now, it's a little blurry right after the procedure.
Makes sense.
But if you came in with a thick correction, it is dramatic when you get up off the table.
Now, I had a friend once, I'll share this story, that she went and had the procedure done, and this was years ago. And I said, "Why are you doing that? Oh, that's scary, I couldn't do that." And she said, when she gave birth and her child, her son, was born, she couldn't see him.
Really?
She could not see him, and she said that's when she said she needed to do it. And she said the second she had it done, she looked up and she saw the clock on the wall, and she said she just started crying. So, I mean, I imagine that happens to you a lot. You have a lot of, oh my gosh, emotional moments.
It does. It's life-changing for many people.
How rewarding
it is
to have that kind of.
It is. Nothing's more rewarding than a happy patient.
Yeah, no kidding.
I have one last question. I
Yeah,
want to wrap up, but one last question.
Yeah.
Because this is something that, for myself, I was blessed with really good vision, and I've never really had an issue. What about maintenance to maintain good vision? Is there something? Should I be seeing you to maintain my vision?
Are you eating your carrots and spinach?
No, but I've been eating chocolate chip cookies.
Well, you should. Diet is actually important. It is important in terms of antioxidants. We've got patients with macular degeneration now who we put on vitamins because vitamin treatment has been shown to be healthy for the retinas in particular. So as we get older, dietary influences are more important. But
I should probably be seeing you once a year, once every 2 years, to maintain.
Certainly when you hit 40, which is probably not for another 10 years.
Oh, you're funny.
But when you do, we should see you for a baseline evaluation.
So I'm a year late.
To make sure you're, you're not there yet. Yeah. But anybody who's 40 or over should be tested for glaucoma. Glaucoma has no symptoms, and that's a disease that can rob you of vision without you even knowing it.
Really?
Okay, I've got another question, because you brought it up. My mom watches the program. She's in Kansas City. She suffers from macular degeneration. So she has to go in and get a shot every, gosh, I'm trying to remember now, every few weeks or so to help with that. Is that something that she's going to have to continue, or are there possible advancements on the horizon, near horizon perhaps, that that would be able to help someone with macular degeneration?
There are tremendous advancements in macular degeneration, and so these drugs and protocols are continuing to evolve.
Mm-hmm. Very good. Dr. Helm, thank you very much.
You bet.
We really
Thanks for
appreciate
coming.
your time.
Thank you, Dr. Helm.
It's a
That's
pleasure to have
great.
you.
We'll be right back.